Get some more now on the junior doctor strikes, which are set to begin tomorrow. Joining us is the Chief Executive of the NHS Confederation, Matthew Taylor. Hi, Mr. Taylor. It's good to see you as always. Thanks for joining us. How concerned are you about what's going to happen from tomorrow?
Well, it's going to be an incredibly tough week. So we've got the 4 days of industrial action, which of course come after the Easter bank holiday weekend, followed by another weekend. So you're talking about 10 or 11 days when the NHS is not able to operate at full strength. And that's going to have a huge impact on our capacity to recover services, to make inroads into those long waiting lists. So essentially what's going to have to happen is that we're going to rely on consultants to fill in for junior doctors, who, as your report earlier emphasised, make up more than half of the medical workforce. And it's going to be tough to maintain those emergency services, to maintain that urgent care. But even if we manage to do that, what will happen is we'll virtually have to stop all of the other things that we do. And that's why we're estimating 250, maybe up to 350,000 cancelled appointments and operations next week.
Which patients are going to be most impacted?
Well, the patients being most impacted are those who are expected to have an outpatient appointment or an operation next week and who have had that cancelled. And I'd want to emphasise that you probably would have been told by now, if you're expecting an appointment or an operation, that it has been cancelled. So if you've not been told that, then do turn up. But our members have told us that they're basically having to stop all of that kind of elective care. I mean, I visited a hospital a few months ago, which is a new hospital. It's dedicated almost entirely to undertaking elective care, knees, hips, those kinds of things, very modern facility. In the last strike, that basically had to close down for the duration of the strike. I'm sure that'll have to happen again. So these strikes are going to have a catastrophic impact on the capacity of the NHS to recover services. Because as we've discussed before, Kay, what the health service has to do is it has to meet high levels of demand, presenting themselves at the front door of GP surgeries, accident and emergency departments, at the same time as making inroads into that huge backlog that had built up before COVID, but then built up much more during COVID. And that's a tough thing to do at the best of times. It's impossible to do when these strikes are continuing.
Does everybody who needs urgent care, will they get it this week?
Well, we hope so, but there's no point hiding the fact that there will be risks to patient safety, risks to patient dignity, because we're not able to provide the kind of care that we want to. We will rely, as I've said, on consultants who are able to help. But this is a holiday period. Your report just then emphasised the fact that it's Passover, it's Ramadan. So we won't have many of those consultants won't be available because they'll be on holiday, long-planned holidays. So it is going to be a tough time. We would say to the public, obviously, if you have a medical emergency, you need to call 999. But if you have a concern, then there's 111, there's the NHS website. Try to use the NHS's in the most responsible way you can. And I have to say this as well, try to avoid risky behaviour, because the NHS is not going to be able to provide the level of care that we want to provide. But look, the most important thing to say is that the two sides have got to start talking. I think what's the most depressing thing about the last few days is that even as we become more acutely aware of the impact of these strikes, what we're seeing is a battle of rhetoric rather than talks. And we need the two sides to start talking.
What impact, if any, will it have on GP care this week?
Well, it will have some impact because, of course, junior doctors are training GPs as well. So there'll be an impact on primary care. There'll be impact on all parts of the health service. As is normally the case, we tend to focus on what goes in hospitals, but of course, hospitals are only a part of the NHS. So there'll be impact ramifications across all parts of the NHS, mental health services, community services. We are losing the largest part of our medical workforce, and it has a huge impact.
35% is what junior doctors want. How realistic is that?
Well, I have to say, I'm really not sure what's going on in terms of the stances of the two sides here. Yes, that's the claim that the junior doctors have put in, but as I understand it, the BMA have made it pretty clear that that's the starting point for negotiation. The Secretary of State said yesterday that he won't talk because the BMA is making that demand. I mean, I have to say to both sides that this is what negotiation is. You enter negotiation, you have different starting points, and then you move towards some kind of compromise. And, we're still waiting to see whether workers will approve the settlement we had for ambulance workers, nurses, other staff. But there we saw 2 or 3 months when the government held out. There was no negotiation. That had consequences for the health service. Why do we have to go through this again? So I would actually say now, I would call on the government and the BMA to reach out to ACAS and ask the Conciliation Service to come in and try to find a basis for the two sides to go forward. Because at the moment we're seeing no movement. And that means not only do we face these strikes, but we face the prospect of further strikes.
Let's see what happens over the next few days. It's going to be a challenging time, whatever. We appreciate you taking the time to join us. Happy Easter Monday. Thank you.
Thank you.